Is it normal for women to experience pain while sex, or have we as women just accepted it as the norm? Do irregular periods cause weight gain, or is it vice versa? How much of infertility is male related but hidden? Do you think women are subjected to fertility treatments unnecessarily? What is that one question women feel too shy to ask?
We don't speak about these subjects openly. The misinformation gives rise to that kind of a feeling that I'm unhealthy and you tend to do unnecessary things.
Today on Real and Unapologetic, we bring you a voice that champions women's health with both science and sensitivity. Our guest is not only a highly acclaimed gynecologist, but also a fierce advocate for breaking the silence around women's choices, bodies, and well-being. With years of experience guiding women through everything from adolescence to motherhood and beyond, she has empowered several individuals to take charge of their health without any shame or fear. In a world full of myths, misinformation, and hesitation, she stands for clarity, confidence, and compassion. Please join me in welcoming Dr. Vaishali Joshi, who believes that everyone deserves to feel strong and unapologetically in control of her body. Dr. Joshi, thank you for being here on Real and Unapologetic.
Thank you, Charlene. It's my pleasure to come on this platform and help every woman out there.
Doctor, I would like you to bust some myths.
Yes, definitely.
Do irregular periods cause weight gain, or is it vice versa?
I think it's a very common myth that when a woman gets a period, it's the body's waste which is thrown out of our system. And when a woman doesn't get a period, that waste gets accumulated in our body in the form of fat. But it's not like that. When the weight gain happens, it triggers hormonal changes, and that disturbs our regular menstrual cycle, and the woman starts getting irregular periods.
Okay.
Yes.
Doctor, is white discharge always a problem?
No, actually white discharge is a normal physiological way of our body telling us that the woman has good hormonal health. Sometimes before periods and just after periods or at the time of sexual excitation, you tend to get more white discharge. It's a perfectly healthy discharge. But when this discharge has a color, when it has an odor, and when it causes itching down below, then definitely there is a problem.
Okay. Doctor, do intimate washes actually help or cause any harm?
Intimate washes do more harm when they are used without any indication. Sometimes after doctor's advice, one can use it for a short time, and that time it may be helpful. But using it routinely to keep you hygienic, it's a wrong practice.
Okay. Doctor, let us now talk about some taboos. Why do so many women feel ashamed of their vaginal health?
As you know, Charlene, talking about genital organs, vagina, vulva, it's tabooed in society and nobody talks about it openly. And that's the reason there is a lot of misunderstanding, misconception about what is vaginal health. Actually, the body looks after its own passages. Because we don't speak about these subjects openly, the misinformation gives rise to that kind of a feeling that I'm unhealthy and you tend to do unnecessary things.
Doctor, my next question is it normal for women to experience pain while sex, or have we as women just accepted it as the norm?
To experience pain every time during sex is not normal at all. It's okay for the first time, but later on, if somebody is experiencing it then it definitely needs investigation. It may be because of different underlying organic problems like vaginal infection. You must have heard about endometriosis. So these are very serious conditions which really need to be investigated if somebody is consistently having pain at the time of sex.
Doctor, is it necessary to take a break from one's exercise routine while being on period?
I think that's a very good question, Charlene, because traditionally in our society, when a woman is on period, in the previous era she used to be restricted in one room. Nowadays actually we say that a woman should continue doing her routine physical activity, particularly if a woman is experiencing period pain or painful periods, then she should do some lower back pelvic floor exercises that will help to relieve the spasm of those muscles and the pain will be much less. So one definitely should carry on doing the routine physical activities.
Thank you, doctor, for busting this myth and bringing to our attention that it is okay for a woman to not be laid back while on period. She can choose to continue with her exercise routine or other physical activities in spite of being on period, and that it is absolutely okay.
Yes, definitely, yes.
Doctor, are Indian women prioritizing their partner's comfort over their own health?
I think yes, because as you know, women have been always submissive, and particularly in our male dominated society. If she speaks out, then she has the fear that her husband or partner will think that she is not much interested in the relationship. And being submissive, that kind of a mindset has been ingrained in women. That's the reality, unfortunately.
So most women prioritize their partner's comfort over their own health.
Yes.
That is sad, but true. Doctor, what is the one sexual health issue that women suffer through silently?
The most common issue, I would say, is the pain at the time of sex. Because the pain can have an impact on the interpersonal relationship, on the sex drive. And this can lead to disruption in the family life, and it can be really bad because we may be overlooking the underlying serious problems.
As you said, doctor, most women suffer from relentless pain during sex, and this goes unnoticed and unheard. And it is time women started speaking about it, because it could be due to underlying health problems.
We need to give women that courage and confidence and empower them that this is not right. I think even the husband or male partner, if he doesn't know, he won't be there to support. So it's a matter of speaking out, identifying the problem so that these problems are investigated and treated at the earliest.
So true. Doctor, can ignoring sexual discomfort lead to long-term damage?
Yes, medical conditions which are pelvic infections, which are completely treatable and the pain can go away. The other condition is endometriosis. Endometriosis is a condition where the lining of the uterus is found outside the uterus, inside the tummy, and then it causes lot of inflammation in the inner body, and that gives rise to pain at the time of sex, and the pain can be long standing. These conditions are treatable and they need to be addressed, because if we don't, then it can have an effect on the husband-wife relationship, on the family unit, and it can have an effect on the woman's health. Sometimes endometriosis can damage kidneys, it can go and get itself in the intestine. So these are the very serious things which we need to address. Having pain at the time of sex have long-term implications and health hazards.
Doctor, most people are of the opinion that unprotected sex does not lead to pregnancy if the ejaculation takes place outside. What do you feel about it, doctor?
Good you asked me that question, because it is a common practice of preventing pregnancies. Unfortunately, it's not foolproof. I would say it's less effective contraception. It has been seen that even pre-ejaculation secretions have sperms in it, and the pregnancy can still happen. And there have been cases reported that if the ejaculation happens over the perineum, still the woman can get pregnant. So one has to be very careful.
Okay, so you mean to say slightly outside the private area, even
Yes.
that
Yes.
is very risky?
Yes.
The youth believes that unprotected sex can lead to pregnancy if and only if the ejaculation takes place inside. But you have busted this myth.
Yes.
Doctor, let us now talk about fertility and societal pressure. Doctor, why is a woman's worth still tied to motherhood?
Right from the beginning of the society, women have been told that the whole aim of their life is to become a mother. The real empowerment of a woman is beyond that. Her career, her health has never been given that much importance. And I would say almost 90 to 95% of women want to become a mother. And maybe it is a natural instinct for a woman. Things can be difficult to achieve that goal all the time, and that should not push a woman into depression. There is life beyond motherhood as well. And if you cannot achieve it, you still can live life to the fullest. That is what is very important.
Doctor, I have been advised by my nephrologist to not contemplate getting pregnant, or the idea of conceiving through pregnancy. Reason being, I have a medical disorder called SLE, systemic lupus erythematosus. So I feel that there are other options available for me, such as adoption and surrogacy. There might be several women out there, just like me, who cannot conceive due to health conditions. And to them, I would like to say that there is hope, as there are other procedures available in our country. There is the option of adoption. There is also the option of surrogacy. So we need not lose heart.
I think having the mother instinct, you can use it in any aspect of your life. Like you said, adoption. There are a lot of orphanages. You can go and give your services. As mothers, we look after our children. The same thing you can do for other people who are less fortunate, who don't have the advantages like we have, and make them capable of standing on their feet. It is how you look at things.
Absolutely. It's the shift in perspective that is much needed.
Yes.
Doctor, how much of infertility is male related but hidden?
Infertility overall, in that almost 1/3 of the causes are related to the male factor. Again, 1/3 are unexplained. In that also there are many times the male factor. That's a reality. The female factors are almost 30%. And really, frankly speaking, when we talk about infertility, it's not a blame game. So we don't kind of make the couple feel it's because of his fault, her fault. The statistics are like that, that almost 1/3 is because of the male factor.
Okay. But doctor, it is always a woman who is held responsible for infertility issues?
Yes, I think that's a usual norm, particularly in rural areas, even in metro cities. The first thing when a couple is unable to conceive, the mother-in-law, the family will start pointing fingers towards the woman. They don't understand that to make a baby, we need a male factor, that is sperms, and obviously a woman who needs to produce an egg. What our society needs is an awareness and education of the partners to take onus on both of them and go and approach the gynecologist to find out the causes of infertility.
So, infertility issues can rise from either of the two parties.
Yes, yeah, that's the fact.
Doctor, do you think women are subjected to fertility treatments unnecessarily?
As we discussed, that many times women are the first one to blame for infertility, and nowadays we are in an era of quick fix, 5 minutes delivery. Everybody wants a guaranteed return, and they think going to fertility clinics, going through IVF can guarantee fertility, and that's the reason women have to go through these processes sometimes at very young age, even after trying for a year. So this is where the public awareness and woman empowerment comes into action.
Doctor, what are your thoughts about the contraceptive rights of women?
I think you have asked a very pertinent and right question on this platform, because every woman should be aware of her contraception rights. What do you mean by contraception? A woman's ability to decide when she should get pregnant and at what age, and if she wants to have more children, how much gap she should keep in between, and the number of children.
Okay.
So this is what contraceptive choices mean. Basically, the methods of contraceptions available are dependent on man's choice. The one which is commonly available, simple condom. The one which women can use, those are like birth control pills, intrauterine devices. There are a lot of myths about these methods. That's the reason women are reluctant to use them. That's where the myth and misunderstanding needs to be cleared.
So, you do believe in the contraceptive rights of women?
Yes.
That's very progressive thinking.
Yes.
However, some people are of the opinion that one should just go with the flow, which I would say is quite regressive.
Yes, we are in the era of freedom to think. I think it's a question of balance.
And I believe a woman has the right to planned pregnancy. It need not be rushed. It could be a very thought out initiative.
Yes, I think that's where the pre-pregnancy planning and making sure that you give birth to a healthy baby comes from. So it is very, very important for women to have that understanding and clear discussion with her partner regarding the method of contraception.
Doctor, today we see that more and more women are choosing to opt for planned pregnancy. They prefer to first prepare themselves thoroughly for pregnancy, health-wise, mentally, and most importantly, financially. What are your opinions on planned versus unplanned pregnancy?
Unplanned pregnancies are obviously because of many times contraceptive failure. The planned pregnancies are better because every mother wants to give the best start to her unborn child, and the only way to do it is making sure that she is healthy. If she has any other health issues, those health issues are well controlled, and then planning a pregnancy will ensure that the pregnancy journey will be healthy, uncomplicated for healthy baby and healthy mother. So it's very important to have planned pregnancies for betterment of mother and the baby as well.
Doctor, let us now focus on some hard-hitting truths. What's the one dangerous trend that you're seeing in women's health today?
Use of ChatGPT and social media influencer and following their advice blindly.
Yeah, indeed. So they don't consult a professional.
Yeah. So basically, many times women come to us with full of knowledge and sometimes telling us that why you're not prescribing this medicine, because that's what ChatGPT is telling us. So that's the main problem. The ChatGPT is a general tool which gives information. They cannot individualize the treatment. They cannot have a risk assessment of a patient. Unfortunately, this has been a new trend and it's really a big health hazard.
AI will always remain artificial intelligence. It can never compete with human intelligence. Correct?
Yes, that's right.
People should understand that when it comes to tailored or customized treatments, one cannot rely entirely on artificial intelligence.
Yes, well said.
Doctor, are Instagram health influencers misleading women?
I would say yes, because many of them really don't have any medical degrees. I think they are sharing their personal experiences, but what's the science behind it? What's the knowledge behind it? Nobody knows. And it may not be applicable to other individuals. You should consult a qualified practitioner and do not put your life or health at risk.
Correct. So just because something works for them does not necessarily mean that it may apply to all.
Yes.
So there is no one size fits all remedy in medical science.
Yes, that's right.
Every patient or individual is to be treated uniquely.
Yes. As you know, there are some paid promotions. So you have to be very skeptical about all these hidden things.
So true. Yeah. Come to think of it, they could be pushing a product or a treatment entirely because they have been paid to do so.
Yeah.
Doctor, what damage does self-medication with hormonal pills cause?
I would say self-medication with hormonal pills should really never be done, because you don't want to disturb your hormonal health. If somebody does self-medication, they are not aware of all the intricacies, and you are going to affect your health in a bad way if you self-medicate.
Doctor, are you in a mood for a rapid fire round?
Yeah, let's try. I am not very good at it, but let's try.
I have a feeling that you would do immensely well. One thing women should stop doing immediately.
Self-neglect.
One thing women should start doing right now.
Self-love.
Always, always.
Yes,
That never goes out of style.
absolutely.
Most unnecessary female hygiene product.
Vaginal douche.
So doctor, you find vaginal douche completely unnecessary.
Yes, definitely.
Doctor, what is that one question women feel too shy to ask?
Availability of condom.
Yeah, I wonder why we as women feel embarrassed.
The guy may think that this woman is fast, no moral, or characterless.
True.
But the other side of the coin is she is making sure that she avoids unplanned pregnancies, has safe sex, and make sure that she gets protected from sexually transmitted infections.
Yes, one should choose health even at the risk of coming across as somebody who is characterless.
One has to be unapologetic when your health is at risk.
Absolutely, yeah. Health is above all.
Yes.
Doctor, can you share with me one emotional incident or one such case that has stayed with you till date?
So I come across lots of cases. The recent one was really critical, and it was a life and death situation. This woman had conceived after 10 years of infertility and was 9 months pregnant with high blood pressure, diabetes, and platelet count of 10,000 because she was dengue positive. She was at the risk of bleeding because the platelets were 10,000 and she would have bled to death. So the husband was literally crying in front of me whether he should prioritize his wife's life against his unborn child. So we took the decision, we did the delivery. The baby had to go to the NICU and mother had to go to ICU. They managed to go home, both mother and baby, after 10 days. It was like catch-22 situation for that husband and to be dad. And for us, it was a extra added responsibility to make sure the mother sails through these turbulent waters of low platelet, high blood pressure, unconsciousness. And these are the challenges which we come across day in, day out.
That's such an emotionally touching incident that you narrated.
Yeah.
Doctor, do women come to you more scared or more uninformed?
I think more scared. The experience to going to a gynecologist or simply doing a pap smear, that is a cervical cancer screening test, that itself scares them because of misinformation on this social media.
And the way to deal with this kind of situation would be to stop relying heavily on artificial intelligence.
There are good websites available which are supported by different NGOs, different organizations like Royal College of Obstetrician and Gynecologists, FOXY. These are the international, national bodies, and they want to make sure that women all over India, even in the remote part of India, should have correct knowledge.
Doctor, what is that one event which has caused you to be more empathetic towards your patients?
I think it's a really good question, because when we become doctors, particularly obstetrician and gynecologists, we have all the book knowledge. What had changed me completely and made me a better clinician, doctor, is my own experience of pregnancy, childbirth. It has made me empathetic. I can relate to any woman who walks in my clinic with any gynae or pregnancy issues. I know what they are going through physically, mentally, emotionally, and that's where the life experiences count.
So basically, you put yourself into the shoes of your patients.
Yes.
And then you analyze the situation.
Yes.
And that gives your approach a human touch.
Yes, that's right.
Doctor, if women stop feeling ashamed of their bodies today, what changes tomorrow?
I think it will be a different world of woman empowerment. Women will be so empowered that their careers, their self-respect, the avenues and the professions they pursue will be way different. And as we know, women are very important part of our society. And if women can break those binds or break those
Stereotypes.
stereotypes, then there is nobody to stop.
True.
And it will be a woman-centric society.
Yes.
I think that's what we aim for.
Just the removal of body shame from the psyche of a woman can do so much wonders to her mindset. We live with so much shame and guilt that we pay no attention to our full potential.
Yes, healthy life will be the goal. We will be having a healthy society,
Yeah.
and I will be out of job.
No. There would be some or the other problem pertaining to gynecology.
Yeah. No, I will be always there to guide them to stay healthy,
Yes.
to create a healthy future generation.
So, Doctor, your message to the society, especially to women at large, would be to let go of all the fear, shame, and guilt that we have been conditioned to live with. And if we could do that, sky would be the limit.
Well said, really, really. That is so important to break those barriers.
On that note, Doctor, thank you so much for being here on Real and Unapologetic, for sharing such amazing information with us that I believe is highly thought-provoking. And I believe you are the kind of woman that we need in our society. It is not just enough to discuss women empowerment, but also to apply our thoughts to our everyday living and make our lives exemplary. Thank you so much, Doctor.
Thank you, Charlene.
Thank you.